Hello, my name is Dr. Chelsea Schufelt, and I'm a neuropsychology fellow here at Shepherd Center. What I'm going to talk to you about today is some of the basics of the brain. We're going to go over some of the neuroanatomy associated with the brain, and also part of the recovery process here at Shepherd Center and beyond. When we look at the brain, we see different folds within it, and these crevices in these folds are called gyri and sulci. And then further looking at the structure of the brain, we call the outside of our brain the cortex, or the cortical structures. And then parts of our brain that are deeper within the brain are our subcortical structures. And these are the things that keep us alive. Then further looking at the brain is then divided into two different hemispheres. We have our right hemisphere and our left hemisphere. And they're organized pretty similar in nature. The biggest difference between the two different hemispheres is that they work contralaterally, meaning the right side of our brain controls the left side of our body, and then the left side of our brain controls the right side of our body. And the other big difference between the two different hemispheres is that our left hemisphere, in most right-handed individuals, controls our speech and language functioning. And we're going to talk about that a little bit later when we talk about the temporal lobe. The first lobe we're going to speak about today is our frontal lobes. Our frontal lobes are responsible for our executive functioning. So such things as our attention, our concentration, our ability to be abstract in our thought process. Another thing that our frontal lobes are responsible for is our ability to inhibit some of our behaviors. And sometimes when there's an injury to the frontal lobes, patients may present as very disinhibited, meaning that they're lacking the social filter. It's just important to remember that some of these behaviors are not purposeful in nature, but it's just a part of the brain injury. Another thing that you may see after a traumatic brain injury is what we call confabulation. Patients may be still in a state of confusion and disorientation, and their brain attempts to fill in the gaps. Another behavioral consequence of a traumatic brain injury is perseveration. A patient may get a certain idea or topic or behavior kind of stuck in their head, and it's very hard for them to deviate from that thought or behavioral process. Another thing that you may see is that a patient may present with decreased insight and awareness, and they may deny or not really fully appreciate the extent of both their cognitive and or their physical deficits. The next lobe we're going to talk about is our temporal lobes. Again, they're centered right here on each hemisphere. What our temporal lobes are responsible for is our ability to process auditory information, so being able to recognize and discriminate between different things. Another important aspect of our temporal lobes is that it deals with our speech and language functioning. After an individual has a traumatic brain injury, they may present with different types of aphasia, or disturbances in language functioning. A patient may have a receptive aphasia, meaning they're having difficulty understanding information that's being told to them, and or they may have difficulty with expressive language, their ability to express themselves appropriately. Sometimes after traumatic brain injury, we also notice that a patient has global aphasia. When a patient has global aphasia, it means that they're having difficulty in both receptive and expressive language. Deeper within our temporal lobes is our hippocampus. Our hippocampus is responsible for our memory, so both our short-term and our long-term memories. After a traumatic brain injury, you may notice that you or your loved one is having more difficulty with short-term memory, meaning learning new information. So such things as remembering the name of your therapist or your room number, things that are happening since your accident. The next lobe we're going to talk about today is our parietal lobe. Our parietal lobe starts with our sensory strip. And our sensory strip is responsible for our ability to detect touch and pain. The other thing that our parietal lobe is responsible for is our visual spatial processing. When there's an injury to the parietal lobe, you may notice that you or your loved one are having inattention to a part of your hemisphere. So not paying attention to certain things in the left hemisphere of your environment. And then the last lobe we're going to talk about today is our occipital lobe. Again, it sits in the back of the brain, is responsible for our basic visual processing. So we see with our eyes, visual input comes in through our eyes, but that information has to be transmitted all the way into the back of our brain where it's processed. After a traumatic brain injury, you may notice that you or your loved one may have some visual difficulties, such as double vision. And the last component of the brain, of the structure of the brain that we're going to talk about today is our cerebellum. Our cerebellum is responsible for fine motor coordination, and you may notice that after a brain injury, if there's an injury to the cerebellum, the patient may present with ataxia or difficulty with balance and coordination. So when thinking about the recovery process from a traumatic brain injury, here at Shepherd Center, we take a team approach to treatment. The team approach to treatment is typically composed of your physician, the nursing staff, your case manager, your treatment team, which is again composed of your occupational therapist, your physical therapist, your speech therapist, and your recreational therapist, as well as your neuropsychologist. When thinking about the different disciplines, what neuropsychology is responsible for is dealing with an individual who has any type of neurological injury or insult, and how is the person now coping from an emotional, from a behavioral, and also from a cognitive perspective. One thing that may happen while you're here at Shepherd Center is that your neuropsychologist may have you undergo a comprehensive neuropsychological evaluation. One of the things that neuropsychological evaluations are helpful for is understanding and getting a more comprehensive look at how the patient is doing cognitively. And so we look at various domains of cognition, such things as attention, concentration, language functioning, visual spatial skills, memory, executive functioning, as well as emotional functioning. If you or your loved one undergoes a comprehensive neuropsychological evaluation here, your neuropsychologist will sit down with you and review all the results and discuss some of the recommendations based on the evaluation. The inpatient neuropsychological evaluation is often helpful in getting a baseline assessment of how you're functioning now, and it helps compare your progress as you continue throughout this recovery process. So now we're going to talk about the different treatment disciplines. Let's first talk about occupational therapy. Your occupational therapist is going to be responsible in working with you and dealing with activities of daily living, so such things as showering, bathing, grooming, and they're also going to be responsible in working with your upper body, so such things as your hands and your arms. They also are responsible for doing our vision assessments. The next therapy that you will have here at Shepherd is physical therapy. Our physical therapists are responsible for working with your trunk or torso control, as well as your lower body functioning. Our physical therapists are also responsible for ordering any equipment by the time that you leave us here at Shepherd Center. The next therapy that you'll have here at Shepherd is speech therapy. Our speech therapists are responsible for working with your diet levels, so such things as your swallowing, as well as working with you from a cognitive perspective, so your attention, your concentration, your memory. So the last therapy we're going to talk about today is therapeutic recreation. What therapeutic recreation will help? What your therapeutic recreation therapist and you will do is develop fun activities that help maximize the goals that have been set out by physical therapy, occupational therapy, and speech therapy. Our therapeutic recreation therapist also will help with community outings, and so you may do such things as going to restaurants or going bowling with other patients here in the hospital. The other thing I want to stress today is the importance of, again, working as part of a team. Again, the team is composed of both staff here at Shepherd Center, as well as the patient and the family. When thinking about a traumatic brain injury, although the injury happened to you or your loved one, this has no doubt impacted your entire family. It's really important to make sure that you're taking care of yourself. Self-care is essential during the recovery process. Here at Shepherd Center, we offer both resources for patients and for families. We hold patient adjustment groups as well as family adjustment groups. We also offer peer support groups where survivors of brain injury and their families will come and speak about their experience throughout the recovery process. And that's a really good opportunity to ask any questions that you may have about the recovery process. One of the things that's important to keep in mind is that after a brain injury, an individual is more likely to develop substance abuse issues. One of the recommendations that your team will make to you is that you abstain from the use of alcohol and other illicit substances. There are support groups available if you have any difficulties abstaining from these substances post-discharge.